Hi, my name is Jo.
And I'm Kate.
We both specialise in helping people with problems in their brain, like migraines, a type of headache.
We work in the neurology team at Great Ormond Street Hospital for Children in England, supporting children and young people to understand their brains and how they can live life to the full, even with the challenges they face. Today, with the help of patients, we're going to explain what migraines feel like and why they happen. What are the signs and symptoms of migraines?
The symptoms of a migraine can be really unpleasant and can cause real difficulties for someone. A typical report given by one of our patients was, "I feel like the front of my head is banging and I have a sharp pain at the back of my eye. Then I start being sick." The signs and symptoms of migraine can be different for each person. Another young person told us that they feel constant pain and had headaches 5 times a day, and it used to be distressing, and that it can all feel scary and isolating. We know that some common symptoms young people feel during a migraine might include a significant amount of head pain, like it's pounding, thumping or drilling. Some report a mood change or increased anxiety before, during and just after a headache episode. They may feel sick or sometimes vomit. They may feel dizzy or faint, or that the surroundings are spinning. Some young people have changes in vision during an episode. Light, noise and movement can make the symptoms worse. Symptoms can also vary over time, so a young person may have one symptom when they are younger and a different one when they are a teenager and adult. The symptoms might last a short or long time. Keeping a headache diary is a good way of tracking symptoms over time.
How do you know if someone has migraines? Migraines are a type of headache, and there are 2 main types of migraine. One is migraine without aura. This is sometimes called classic or common migraine, as it's the most common type. This is a recurring headache, which is painful. The pain feels like it pulses, and people can feel nauseous. It can make some people throw up. These symptoms often get worse with light, sound, and physical activity. Other symptoms can include dizziness, yawning, a lack of energy, mood changes, and needing to use the toilet more often. The other type is migraine with aura. Aura affects around 3 in 10 people who have migraine. Aura means there are changes that the person feels usually at the beginning of the migraine attack, before the other symptoms begin. It may be something that they see, such as bright lights, shapes, or lines. They may experience a distinctive taste or smell, or feel objects a different distance away than in reality. These feelings do go away, but aura can be confusing and make people feel anxious and upset. There are various types of headache, as well as migraine, and the diagnosis will affect the types of treatment recommended by a healthcare professional. If a young person thinks they may be struggling with migraines, being able to describe signs and symptoms can help with diagnosis. Patients have told us that getting a diagnosis can be really helpful. One patient said that now you know what it is, you can treat it, and that it's made them more hopeful.
Why do migraines happen? There are lots of different things that can cause migraines, and young people that have migraines can learn about the links between things that happen in day-to-day life that may make a headache more likely. These are called triggers. Patients have told us things like, "I know I'm going to get stressed and get headaches." One patient said, "I have to be careful with what I'm doing and where I am." This patient recognises that they need to think about planning ahead. Triggers can include not drinking enough water, feeling tired or stressed. Keeping a headache diary can help to identify and then manage triggers. Migraine and other headache conditions usually have a genetic cause. Your genes are made of DNA, and they make you who you are, including how you look, how your body works. Parents pass genes to their children, and it's likely that other family members are also affected by headache symptoms. This also means symptoms of headache or migraine can affect young children, but it's generally older children and in the early teenage years that headaches become problematic. We do not know exactly what happens in the brain when we have a migraine, but researchers think the brain is made more sensitive due to the nerves, chemicals, and blood flow not functioning in the ways expected. Although this sounds really concerning, We do know that migraine and headache itself cannot cause long-term damage to the brain, no matter how severe.
Will people believe and understand that I have migraine or headaches? Many children and young people do not speak up when they have a headache and try to carry on functioning as they would usually. This means that parents, school staff and health professionals often do not know who has difficulties with headache until the symptoms become severe. If treatments and coping strategies are introduced early, headaches and migraines can be managed, usually allowing young people to live a full life encompassing all the things that they enjoy, such as school, travel, sports and socialising. We know that for young people with severe headache or migraine, life will be challenging when symptoms are at their worst and they're feeling very unwell. It may be difficult to attend school or usual clubs due to difficulties faced with focusing, concentrating or exercising for long periods. A patient said, "I can speak to my friends about my migraines, but it's hard for them to understand. And often when I have tried to speak to adults, they have told me that migraines are nothing, implying that I'm making a fuss for no good reason." It is very common for young people with headache and migraine to say they feel that they're missing out or can't talk to anyone about how they're feeling as the impact of their symptoms aren't taken seriously. Headache specialists are experienced at caring for people with mild, moderate and severe symptoms caused by headache conditions and will acknowledge that these symptoms are real and can be debilitating. We are also aware that a headache condition is likely to have a considerable impact on the whole family, as it can put limits on what someone is able to do, and this can result in feelings such as guilt, anger, sadness and resentment.
How do you test for a migraine? There are no specific diagnostic tests for most of the common headache conditions, and the diagnosis is made from descriptions of the symptoms experienced as well as ruling out other possible causes. Diagnosis is guided by the internationally recognised headache classification system alongside national recommendations. Your doctor will take a full medical history and will carry out a neurological assessment. They'll ask questions about a young person as a baby, their growth and development, when the headache started and how the symptoms present. You would be surprised at how often young people have symptoms when they are really young, but do not necessarily report them or think anything of these symptoms. We will want to hear about your headache, how it feels, and we sometimes suggest bringing pictures to describe this or writing some notes before the appointment. We need a detailed description of the symptoms so that there is a clear picture of each individual's problems. We will spend some time asking about lifestyle and school too. Sometimes a video recording of an attack is helpful, especially if there is a behaviour change or a physical change, such as a blocked but running nose or swollen eyes and face. The doctor will carry out a neurological examination, which involves doing some things such as walking in a line on your tiptoes. The doctor is looking at the way the brain is helping a young person to do things. It is really important during the consultation that you tell the healthcare professional as much as you can. The team will want to hear about how the person feels about their experience and how it's affecting day-to-day life.
What is a headache diary? A headache diary keeps a note of which days a headache happens or not, how someone feels and what they might try to feel better. This includes which medicines are taken. Your doctor will ask you to keep a headache diary before you start seeing them and then between your appointments. They might give you one, but you can also design your own or download a headache diary app on your phone. Headache diaries are most useful when they include what you were doing when the symptoms began. For example, were you at school, exercising, or sitting calmly watching a programme? Also, do things improve when there is a change of routine, such as during school holidays? Include things like if you had eaten and drunk enough that day. We recommend that you give your headache a pain score out of 10 and write down if you took any medication, had a day off school, or missed any activities or planned events because of the headache. We know that headache conditions fluctuate in severity and frequency, and it may be hard to find a clear pattern. Try to keep some focus on when you have had no migraines or headaches. This sometimes helps us to see what works well or helps keep the symptoms to a minimum.
Can migraines be cured? It's difficult to say if a migraine can be cured, as they are very likely to have a genetic cause. This means that some people will always have a tendency to have headaches or migraines. However, this does not mean it cannot be managed with medication and support. Migraines often fluctuate throughout different times in our lives, and there will usually be long periods of freedom from symptoms for many people.